It's not actually the native natural mRNA as you would find it from the virus. It's been modified in key ways that we just talked about that affect longevity. What else is supposed to be in a vial of vaccine in addition to the mRNA molecules themselves?
Oh, well, these ones are wrapped in lipid nanoparticles, which also protect it from getting degraded.
Mm-hmm.
So the lipid nanoparticles coat it. That way, when you inject these things, they transfect the actual mammalian cells and they pump the RNA into the cell. So that's new. That's probably the newest part of this technology. There are other small RNA companies out there that are using some versions of LNPs that deliver microRNAs, if you will, that give us some precedence of this being used, but they're administered very differently. They're usually administered with immunosuppressants, and they're given in a slow drip IV.
Mm-hmm.
So it's not a bolus shot like we have with these LNPs, and we don't give these out with immunosuppressive drugs. So that's a completely different platform, and I think those RNAs are a lot easier to make because you can actually make those synthetically. You can just tell an RNA synthesizer to make a 21-mer. That's not hard to do. You can't get an RNA synthesizer to make 4,200 bases. You have to come up with new tools to make RNA that's that long. And that's part of where this story leads, is that in order for them to make these very long RNAs, they actually have to have a polymerase make them off of DNA, which means you've got to have DNA around
Mm.
and presumably get rid of that DNA.
Yeah.
That's where we've kind of stumbled into this story.
So yeah, we'll come to that shortly. So you got the lipid nanoparticles that are basically a protective shell around the mRNA. All that stuff is supposed to be in there. It's part of the design. It's part of the the intention of what is in a vaccine vial. Anything else?
Well, there's some PEG and cholesterol in there as well. I haven't followed up on that as to the implications of those. There's many people concerned that they probably think glycol. Some people are have allergies to it, so maybe that's creating some adverse reactions in some people.
Mm-hmm.
I don't think the cholesterol is necessarily too harmful, but that's about as far as I've gone into the ingredients listing there. Those sort of the four key things that I paid attention to, which is the PEG, the lipid nanoparticle coating itself, the cholesterol, and then the nucleic acids.
Okay. So why don't you just kind of tell us the story of well, you know where we're going. How did you come to be in the position to be actually taking some of these vials and double checking what was inside of them?
Yeah, it's not something I wanted to do.